Imagine responding to someone's child that is having a seizure, and all that you can do is offer them a ride to the hospital. We now have a new tool in our toolbox to be able to stop this deadly occurrence in their home. Pre-hospital administration of Versed benefits the entire populace of our community. It is a very versatile drug that can be given to control seizures, sedate combative patients, to comatose someone who needs to be intubated, or be given to a victim of horrendous trauma that doesn't need to remember what they went through. We will look at the drug profile for Versed now. Versed is a well documented and tested medication. The mechanism of action is that of other benzodiazepines. It will produce sedative properties and prevent new memory formations. The only absolute contraindication for Versed is hypersensitivity to the drug. Beyond that, the rest are relative contraindications. They include myasthenia gravis and other neuromuscular disorders, acute alcohol intoxications, and severe COPD and acute pulmonary insufficiency. Basically, anybody that can't breathe can't be given Versed. There are a few incompatibilities with Versed. Versed may potentiate or increase the action of other depressants, such as other benzos, opiates like hydrocodone, or alcohol. Now that we've covered how it works and when not to administer the drug, let's discuss the ways and why to administer it. Versed can be administered to all ages of the community. The only detail that changes is the dose that will be given. The adult dose for Versed is 2 to 5 milligrams given as a slow intravenous or intraosseous push. This is titrated to effect, which means you can change the dose based on the patient's status. Versed may also be given intramuscular. These doses may be repeated as long as blood pressure and respiratory patterns are monitored. The pediatric dose is more of a weight-based dose of 0.1 milligrams per kilogram slow intravenous intraosseous push. This may also be given intramuscular or intranasally, which means into the nose. The neonate dose varies from the pediatric just a bit. You can administer 0.1 to 0.2 milligrams per kilogram intravenous or intraosseous every 2 to 4 hours, or 0.3 milligrams per kilogram intranasally every 2 to 4 hours. While these doses are different, there are similarities between the ages. We will now cover a few topics that span the generation of patients. The major adverse reactions are hypotension, nausea, vomiting, pain at the injection site, and respiratory compromise, which is in reference to the previous statement that people that can't breathe can't be given Versed. The onset and duration only changes with the way that it's actually administered. With IV or interosseous administration, the onset is very fast at 1 to 2 minutes, and the peak effort or effect is reached at 4 minutes. The duration is quick as well, which means the drug will wear off quicker than other administrations in about 30 minutes. If given intramuscular, the onset can be as long as 15 minutes with peak effect not reached until 15 and 16 minutes. The routes of admin are intravenous and intraosseous slow push, the intramuscular, and intranasal. In regards to intravenous and intraosseous, Versed should be administered slow over 2 minutes. The use of Versed should be meticulous as a reversal agent, Romazicon or Flumazenil, is not carried on any ambulance in our region or even on the eastern seaboard. With this new drug in our arsenal, we should be able to apply it to many of our patients. We covered how this drug works and how to administer Versed, and how much to give to our patients, and who gets how much. We should really be utilizing this drug to alleviate some of the suffering in our community. No longer will we have to tell someone, there is nothing I can do for your child that's having a seizure right now. I can now stop this and bring them back awake. Thank you.